Okay, good morning. This video is for CEP 650, and we're talking about week 13. So we're talking about maple syrup urine disease, MSUD. As asked before, I will go over the whole presentation but emphasize certain points more. I truly believe that at this point it's pretty simple to understand. There's not many new tricks in the book. Genetics is relatively simple if you stay at this level, so I think we'll be fine. I think that the name says everything. I mean, you get what the main symptom is supposed to be, right? Um, and the photo, the picture on slide one definitely makes it easier to understand beyond that. So I'm just gonna jump and start the slides themselves. Let's talk about the in general information. This is an inherited disorder or disease. Obviously, it's inherited. Otherwise, we wouldn't really be talking about it. And this is a disorder or a disease where certain amino acids are not built properly. Um, it gets its name from its distinctive odor in urine, um, which affects infants' urine to start with. So these symptoms come and appear very early in life. Um, the most common and severe form of the disease, meaning that the severe form is the most common, of course, is the classic type, which becomes apparent immediately after birth. Uh, it's the most severe type because there's no enzyme activity at all. We have different forms of the disorder that become apparent or symptomatic later on, from infancy to adulthood, and they are usually milder in symptoms. So we have several subtypes, in this case exactly four. We're talking about the classic MSUD, which is the severe one. We have the intermediate one, we have the intermittent one, and then we have the thiamine responsive MSUD, and we'll talk about each one uh, um, within itself and compare between them. This genetic disorder is rare. It's uh, it's characterized by a deficiency of certain enzymes. These enzymes break down what we call branched chain alpha keto acid dehydrogenase complex. So they are required to break down three branch chain amino acids that are abbreviated BCAAs, and those three are leucine, isoleucine, and valine. Um, all of these three, including their byproducts, accumulate abnormally throughout the whole body. And of course, as you know, uh, much more is not always better. So in this case, definitely we're talking about not a classic storage disorder, but definitely an accumulation. So the unique sign is the maple syrup like smelling urine. This can be, by the way, confusing with two other diseases. One of or conditions, not necessarily diseases. One of them is diabetes, because diabetes, if you remember, by definition, by diabetes mellitus in Greek means honey-like. So yes, their urine is different in color and has a sweet smell to it. Do not confuse between the two. A, B, because of the color, that maple syrup has, it can definitely lead us to think that we're having rhabdomyolysis, uh, um, which is, of course, a very advanced stage of a problem with your renal system as well, although it originates from the muscle. And you know what? Come to think about it, it's not only those two. We can have increased protein in your urine, proteinuria, which will also color urine darker, but is not necessarily rhabdomyolysis. So, three conditions that might be misdiagnosed or confused with. Obviously, in this case, the maple syrup smell is supposed to make the difference. So I said yes. Smell the urine. Apparently, it's part of the need to understand. So you can say, hey, but what does this have to do with me? Well, let's say someone schedule an exercise test with you and they have one of these problems. It might be very relevant to take a urine sample before they exercise test and smell it and see the color. We know by definition from pathophysiology, and you know this, you've been taught this, the darker the color, the worse off you are. So this is very relevant, and we tend not to think about that. We rush to blood pressure and heart rate and O2 sat. There are conditions that it is smart to check urine before they even exercise or be tested. General information about the symptoms, and then we'll go into specific symptoms. So we know that the symptoms are going to vary according to the subform or subtype of the disease. And the symptoms are linked almost directly or tightly to the amount of active enzyme that you have. The less active enzymes that you have, the worse off you are. Of course, maple syrup like smelling urine. And notice that you can also smell it in the sweat of a person, which is definitely relevant to us in exercise testing and exercise in general. What else? We can talk about infections, psychological stress, fasting, trauma, any major change in diet habits, dietary habits, provoked mild to severe symptoms. I don't think this is anything new to you. We know that the environment or environmental factors usually can relieve or take symptoms to the worse to a certain extent. Let's talk about the classic type symptoms. So we see subtle emerging symptoms within 2 to 3 days after birth. That's pretty fast. Poor feeding at bottle or breast, although this is not, notice these are not necessarily unique symptoms to this disease. A lot of infants refuse to breastfeed at their first days. It takes time to create that connection. So, increasing fatigue, of course, you lack enzymes. The lack of enzymes by definition is fatigue. And increasing irritability. Of course, you've just been born and things are not going well. Later symptoms will include in addition, not instead. You can talk about very unique fancying and cycling movements. This is obviously a response to the lack of enzymes. So it's a neurological reaction. To distinct from the example that I'm gonna get, of course, we are not dogs, but nerves are nerves. You know how a dog is on its back, and you kind of scratch a certain area of the belly and the groin, and the leg starts running like crazy. this is what we're talking about right here. So there's a neurological imbalance, and that causes muscles to be imbalanced, and then you get that movement. So just if you needed a kind of picture in your head, that's give or take what we're talking about. It can go from lack of tone to severe lack of tone in the muscles, spasticity. Um, what else? We could talk about the digestive system. So just to remind you that the valgus nerve is a major nerve, you know, running through the stomach and up to the brain, and definitely going to affect not only respiratory aspects but digestive aspects, and that's why you can see that you can have convulsions and even coma. Um, to continue, symptoms towards death. So obviously, death is an option, unfortunately, and definitely the worst symptom on the scale. Um, CNS fails, so anything that has to do with central nervous system, cardiac problems, respiratory problems, uh, um, cognitive problems, motor problems, and so on and so forth. Obviously, respiratory failure, and so on and so forth. We see in addition that symptoms may include loss of bone mass. Um, Obviously, if your bones are getting weaker, one of the options of the outcomes are fractures. So we're talking about basically a type of osteoporosis. Uh, of course, you'll also be um, sensitive to inflammation. So in this case, in the pancreas, we can talk about intracranial hypertension in the brain, a very bad situation to be in, which is associated with nausea and vomiting. Just to remind you that intracranial hypertension means that the mechanical pressure within the brain in a certain area is increasing and is pushing on the centers of your brain, leading to abnormal function and even death. Then we can talk about the intermediate subtype. Um, we can see that the majority of children are diagnosed between the age of 5 months and 7 years. So that's intermediate because it's not immediately after birth. Um, Obviously, they have more enzyme activity than the classic one. These include seizures, neurological impairment, and developmental delays at varying degrees, because obviously you're talking from 5 months to 7 years, then there's a wide range of time, so to speak, to develop different kinds of uh, um, symptoms. Possible feeding problems. Obviously, they have a problem with amino acids, poor growth that connects to the development problems, maple syrup odor in their earwax, in addition to what we saw before in their sweat, their urine, shortly after birth. I just want to say that this symptom intrigued me, not because of the location, because it was not mentioned in relation to the severe form. And I would expect this to be seen in the severe form as well. So I've read several references and articles, and I could not find any indication that the classic or the more severe form actually has symptoms of maple odor, sorry, in their earwax as well. So it's a bit puzzling for me. Definitely surprising. Um, but apparently that's the deal. Then we can see that children can remain asymptomatic until later in life. So it's not, they can be with the disease and be asymptomatic for a long time. Then the third type, the intermittent symptoms, include normal growth and normal intellectual development. So we can see a time issue here, that the earlier you have the symptoms, the worse off they are, right? So earlier symptoms, but the earlier you become symptomatic, the worse they are. You can see that they can often tolerate normal levels of amino acids in their diet, which the others cannot. We can see that symptoms do not appear until the child experiences stress, does not eat, or develops an infection. Translation: the symptoms in this type are triggered mainly by environmental causes. So that's kind of the major bottom line for the third type. And then you can see that symptoms may include lethargy, the maple syrup, and the earwax, sweat and urine, so all three. Ataxia, lack of voluntary coordination of muscle movements. So they'll might have gait abnormalities, metabolic crisis. Just to remind you that metabolic crisis is the severe form of a metabolic disorder. So it's a complication of something, so it's secondary and not primary. Seizures, coma, brain damage. Obviously, if you're going to have coma and seizures, you have some kind of cell injury, usually, right? And then life-threatening neurological complications in rare cases. So death is not on the menu, so to speak, in most cases here, but if it goes south, it goes south very badly. Once again, a milder form of the a milder subtype of the disease, triggered mainly by environmental causes, but in some cases might go to the worst part of the scale and include death. Then we have the last one, which is thiamine response, MSUD. This is a very unique subtype of the disease. Basically, if you think about it, it's kind of puzzling. I'm not sure I would call it another subtype. I'm not sure I would have 4 subtypes instead of 4. Of course, no one's asking my opinion in the medical field, and that's fine. But you'll see that this is in addition to the other types. So basically, it's a form of the disorder that that responds to treatment with vitamin B1. So it has its own niche, but it can still happen with the other subtypes. So a bit in between, if you understand what I'm saying. You can see that the symptoms resemble the intermediate MSUD, meaning that it is second in severity, right? Symptoms rarely apparent in newborns, meaning it's more in those 5 months to 7 years. And you can see that these unique patients, and I underlined it to make sure you don't miss it, are deemed unclassified MSUD. Notice, unclassified MSUD. They do not fit into the first 3 classifications. On the other hand, they have a lot of similarities to them. So kind of, so I guess at some point, and I wasn't part of the loop, obviously, and that's fine. At some point they were like, wait a minute, okay, so they have symptoms like the others. It's similar, but it's different. So what do? We have to decide, are they in the three classifications or not? So they decided not to. But still, you'll see with the information that it sounds like they're the intermediate with a bit of an edge or twist. So don't be confused by that. In this case, the symptoms may not include the maple syrup odor. Odor. Okay, that's I'm confusing that word constantly. Wait a minute. Okay, I thought the screen was closing on me. Um, okay, so giving large doses of thiamine to the child will increase the enzyme activity, which breaks down the three amino acids. So this is definitely an environmental treatment that can help. Notice that we're talking about very large quantities. And you can see that the restrictions are relatively moderate to diet or to amino acids for the more rare type, which we're talking about. A bit of diagnosis, and we have 3 slides about that, so I'll go over them. Nothing here is, very complicated to understand. We need to test them immediately after birth for MSUD with reports or results reported within 24 hours, obviously, because we can have the classic and more severe type, so we want the medical staff at the hospital to test immediately after birth. The earlier they can be diagnosed, obviously, the better the treatment can be, and less risk of permanent damage to the child. That is true with any disease, none the least ones that can be symptomatic immediately after birth. So we have countries that do screen for it and countries that do not. You can see that it is mandatory to screen for this in the US. It's part of the program. It wasn't always, by the way. If you read articles, if this interests you and you read articles, you'll see that it took time to make this mandatory. You can see that we have more than 30 disorders that we can screen for through one blood sample, and one of them is MSUD, and this has the idea that you can use one blood sample and not take multiple definitely helped with the screening process. We can see that the types that develop later on might have normal symptoms immediately after birth, so they can be missed in that immediate after birth screening. So most likely the reaction will be when they become symptomatic. The combination of symptoms should make a physician suspect perhaps MSUD if they're not diagnosed after birth. But of course, writing it this way means that it can be misdiagnosed at times. Urine analysis for high levels of keto acids, blood analysis to detect abnormal high levels of amino acids. Obviously, if you don't have the enzymes to break down amino acids, you're going to see a high level of amino acids in blood and urine. That's the simple logic behind it. Enzymatic diagnosis, of course, to see the amount of copies of the enzymes needed to break down the amino acids. You can also see it through the immune system with white blood cells, lymphocytes, that can be taken from someone's skin. So obviously, as you remember, the symptoms include inflammation, so that would be one of the logical things to diagnose. Of course, you can always go to genetic testing of DNA and see if you have one of the mutations that are associated with the disease. And then you can see the two specific major genes that are tested and a few more. Obviously, genetic testing, when you suspect a genetic order, is one of the things you want to do, but usually we try and avoid that because of the costs and the long time that it takes to get back results. It can take up to 12 weeks. And if there are simpler and faster ways to diagnose, then by all means a physician should try those. Let's talk about the genetic information. It's autosomal recessive. I hope you know what I'm going to say by now. It has nothing to do with the sex chromosomes. It's not X-linked. It's not Y-linked. It's recessive, meaning that it's a weaker version, so to speak, of the disorder. You need two copies, defective copies, one from each parent in order to have the disease. It means that the chances of having the disease between sexes is equal. Then for every new birth, you have a 25% chance of being with the disease, 50% of being a carrier, and then 25% of not being a carrier and not having the disease. We can see that three different genes, are mutated and lead to the disease. We have the BCKDHA, BCKDHB, and then DBT genes. So we see that, and we already know by now that the mutations result in the absence or decreased activity of the complex that breaks down those chain amino acids. We can see an estimated incidence of 1 in 185,000 births. And we've seen worse cases, by the way, if you remember. We've seen 1 in 12 in 500. We've seen 1 in 2,000. This is 1 in 185. That's relatively good, relatively to other rare disorders. So we can see here that although I could have explained it differently, I wanted you to learn the definition of what we called a founder's effect. So when you have an isolated population, a founder's effect means that at some generation the situation started, and that is the founder of the problem in the community. Then you can see that the Mennonite population, especially those who are socially isolated and hence also genetically isolated, which is an idea that we've talked about, we can see that it goes up to 1 in 380, which is definitely very high, very, very high. So obviously the founder effect is the loss of genetic variation, which is a normal result to genetic and social isolation. We can see that a higher level of occurrence is in what we call the Ashkenazi Jews. I would like to explain that. Ashkenazi, actually pronounced Ashkenazi in Hebrew, differentiate between Jews that come from the west part of the world versus the east part of the world. Ashkenazi actually come more from Europe, from Eastern Europe, mostly. So that would include Russia and Poland, Germany, the Ukraine, and so on and so forth. Um, and that's still a distinction used in Judaism still. So mainly Eastern Europe. So for instance, Spain, Portugal uh, are regarded more as Spanish-based Jews. Italy as well. What else? We have mechanisms that are leading to various types of disease seem to clearly be divided into three options. So the mutations are mainly upon three options: a single base pair substitution, which you know is replacing one nucleotide with the other. That is a common and basic mechanism of diseases and genetics, and usually the worst ones. Then we can see a whole axon being deleted or a whole gene being deleted. So three options. Okay. Um, of course, we've seen before that if you lose a whole gene, you lose way more function abilities options than if you just have a single substitution, and the principle is always the greater the genetic material or matter loss, the worse the symptoms. And of course, that can be a great question in the exam. Um, okay, so implications, all of the subtypes lead to accumulation of amino acids. So obviously, that has to affect your diet because if you're accumulating amino acids, you want to decrease their amount in your diet because you don't have the enzymes to break them down. Um, then we can talk about toxicity, especially leucine is highly toxic in high levels. We have to keep the level of accumulation for that amino acid as low as possible. Um, if we're talking about current treatment, we're talking about lifelong treatment therapy um, to level off or limit the amount of amino acids in the blood and toxicity. And then if we have metabolic crisis, which they definitely do, then that's an immediate intervention right there. So obviously, we also want them to be on periodical checks to monitor their situation before we have a crisis. Um, what else that we haven't talked about? Restrictive diet, obviously, um, must start as soon as possible. So starting when you become symptomatic or when you're diagnosed with the disease. Um, we can see that we have artificially made synthetic formulas that provide all the nutrients needed but lack those three amino acids, which we can always do with normal food, right? That was not engineered. Um, then the amount of these amino acids that can be tolerated varies according to the um, severity of the disease. That's kind of a given, right? Um, of course, episodes require treatment. Um, we can talk about dialysis in order to lower the amino acid levels. That, of course, is horrible within itself. Dialysis is a horrible procedure, but might be not might be. It's effective in this case. Um, so that is about current treatment. In regards to possible future treatment, liver transplantation has been used to treat individuals, and it's needs to continue to be um, researched To the best of my knowledge, right now, it's a good option. Of course, you're talking about surgery, but it's producing good outcomes so far. But it hasn't been used enough to have significant statistical power to conclude for the whole population. But it seems to be off to a good start according to the articles that I've read online. Um, and we can see that so far, um, whoever had liver transplant as as a treatment becomes symptomatic free and can resume normal diets. If I remember correctly at this point, because I've read it a few weeks ago, we're talking about 27 patients that became symptom free, and 100% of those who had liver transplants. But once again, we're talking about a sample size of 27, so that's a bit problematic. Um, of course, liver donors and liver donation is problematic, the high costs as well. Um, you can see the hospitals and the clinics that collaborated on this. Um, no, you see, I remembered it incorrectly. It's 52 liver transplants. I don't know. Why did I remember 27? Never mind. It's 52, and you can see from 2004 to 2013, which is not a very high rate. If you think about it, I mean, you're taking a period of 9 years here. You have 52 people. So, that's not many treated per year with this treatment. And at this rate, it will definitely take them many more years to prove the point. Exercise. These patients, these people tend to develop metabolic crisis, especially acidosis. So any kind of intense exercise is definitely off the list. Mild exercise might be beneficial. Of course, you need a physician's authority to that, authorization for that. Mainly, we want to deal with aerobic exercise because proteolysis is decreased or relatively lower in aerobic exercise compared to resistance training. As always, you are most welcome to send me any questions that you have. Have a good one.